What's up, guys? Dr. Corey here from Choffner Rehab and Recovery. And if you're dealing with lower back pain, you're going to want to tune in tonight's session. All right. How do you know if you have sciatica? That is our topic for tonight. We're going to talk about what causes it, right? Aggravating factors, the prognosis, meaning how long is it going to take to heal, and the treatment strategy. Okay. When should you know when to see the doctor, get an MRI after you've been trying physical therapy? Like what certain period of time should you spend trying these exercises and trying different methods of rehab before you opt for an injection or possibly surgery? Okay, so let's start with kind of what is sciatica, all right? It could be many different things, but mainly the main definition from most kind of physical therapy rehabilitation books is irritation of the sciatic nerve or its branches that originate in the lower back. They typically originate at L4, L5, and S1, that lower end of the lower spine, and it can be caused by prolonged pressure on the nerve, a low back injury that causes inflammation around those nerves, and a lower back stenosis. Okay, stenosis is just narrowing of the passageway through which the nerves travel, right? Picture a tunnel that just gets smaller and smaller and smaller as we age, and that's almost like a form of arthritis from wear and tear as we age. So let's jump into the aggravating factors, right? Pain is typically brought on by bending the back into flexion. All right, so that's going to be things like bending over to tie your shoes, right? When you're sitting, kind of crossing your leg over the other, or extension can irritate it as well, overarching your spine, kind of coming back into a backwards bend as well, reaching for the wall behind you. Stretching the sciatic nerve is another way to irritate it or an aggravating factor. And how do you stretch your sciatic nerve? Many people are like, how do I stretch my nerve? It can happen when you sit and you straighten your leg out in front of you, like you're kicking a ball, or bending over with your knees straight, almost like a hamstring stretch, right? So if someone says, keep your legs straight, bend over and touch your toes, which they do normally in physical therapy, you might get a lot of pain with that, okay? Because it's going to actually stretch that sciatic nerve, which you don't want to do initially. Prolonged sitting or driving is another form of flexion that can irritate the sciatic nerve. Or if you're lifting objects, right? If you're bending over to kind of pick up wood and you're stacking wood or something like that, you're doing some outdoorsman work, you're going to have some pain and irritation from that. It's going to make it worse, especially if you're sitting driving, like I just mentioned before, for long periods of time. Like say you have a 30-minute commute to work and back, your spine's going to be pretty irritated if you have sciatica right after that. Okay. Most are going to feel pain when your back is in a flexed position. Okay. Meaning sitting for prolonged periods of time, right? When you're driving, when you're bending over repetitively, all those tend to irritate it because it's going to actually kind of stretch the nerve a bit. All right. What is the prognosis? Meaning how long is it going to take to resolve or what kind of time frame should you look at when you are looking at recovery? All right. Most cases are going to resolve within 4 to 6 weeks. Okay. If you can modify or eliminate activities or positions that aggravate the nerve. Okay. So if you do 4 to 6 weeks of therapy, you listen to your therapist, you do your home exercises, you're still moving, promoting blood flow and nerve health, you should fully recover or not fully all the time, but you should be getting better by that 4 to 6 week mark. I personally see it sometimes take about 12 weeks, right? Almost double that time frame. This is taken from a lot of the rehabilitation books, but from what I see, it can range from anywhere from 6 to 12 weeks. Okay, so be patient. Just know that your function is always going to improve before your pain, meaning you should be able to get more range of motion back. Your strength should slowly improve, and your core stability should improve as well. And if those things are happening in a nice progression, then your pain should start to kind of slowly wean off as well. All right, hopefully that makes sense for you guys. The last thing we're going to talk about is treatment strategy, right? You should not stop working out. Let me say that again. You should not stop working out. Everyone stops working out when they get sciatica because like it's going to make it worse. I need to sit around. I'm going to watch TV. I'm going to lay in bed longer. Maybe it'll feel better if I just rest more. And no, that can actually make it worse. You got to figure out how to work around it, right? So it's usually managed with physical therapy exercises that improve blood flow and nerve health. Okay. A lot of those, I'm not going to go into detail on. We're going to do another video on that. But know that like you should avoid certain positions and you should work into other positions from things that make your spine feel better and promote kind of nerve health to it. And walking actually truly helps a lot, especially on level terrain or softer surface as well. So if your symptoms don't improve after your 4 to 6 weeks of physical therapy, right? Sometimes even 8 weeks if we're pushing it a little bit, and you begin to notice that your legs are getting really weak, where you have that radiating pain or numbness, right? Because with sciatica, you can have pain anywhere from kind of the butt area, kind of all the way back down the thigh into the foot, all the way to the bottom into the toes as well. Sometimes it can kind of come over the front of the foot as well. If you notice that you're getting some weakness with those radiating symptoms after 6 weeks and it's getting worse and you feel weaker and weaker, where it's getting hard to walk or move from sitting to standing because of that weakness, you want to consult the orthopedic doctor as soon as possible. And your next step is going to be again MRI through spinal imaging, and then they might actually want to do an injection or lower back surgery because it might be necessary at that point because of how kind of fast your symptoms progressed. So now you guys know how to kind of look at sciatica, right? The aggravating factors, the prognosis, meaning how long it's going to take to heal, and the treatment strategy. So hopefully that was helpful for you guys. If you want, DM me the word guide for my free weightlifter sciatica guide. If you're watching the replay on YouTube, comment the word guide below. Thank you guys so much for watching. Nice short video for you. And remember, at Choffner Rehab and Recovery, we help you guys online, taking you from 60 to 70% to 100% with your weightlifting. All you need is a phone signal and a backpack of equipment to do it. And remember, DM or comment the word guide down below if you want our sciatica guide to help you get kickstarted and getting over your lower back pain. Thanks, guys. Have a great one.